My name's Aubrey Woodroof. I'm a biochemist from UCLA, spent my career developing tissue heart valves, small diameter arterial prostheses, and most of it developing skin substitutes for burns. Company's name is PermeaDerm Inc. We are trying to advance the art of wound care, both for burns and for chronic wounds. Our approach is to modify the biological coatings that we put in the skin substitute, and we're really interested in an anti-scar compound, which is developed by the University of Rochester, and if we can get that to work, it could be very significant. So the temporary skin substitute developed in the 70s was the first biosynthetic skin substitute approved by the FDA in April 1979. It is composed of three basic components. Very thin membrane of silicone, which allows gases to diffuse across. A nylon component that's physically bonded and entrapped into the silicone that gives the product ability to be stapled or sutured. And then finally, a biological coating that causes it to adhere to the wound. These are the main things that I created in the 70s, and now we want to expand that technology. So we wanted to prove that our product worked as well as cadaver skin. There was a large number of American burn surgeons that did a multi-center randomized prospective comparison of cadaver skin and BioBrain. Conclusions were that BioBrain functioned equally as well as cadaver skin on full thickness 6 size burns. These were large burns, 35% body surface area, plus or minus 20%. Patients are very, very sick, high mortality. But anyway, the conclusion of the study was that BioBrain worked equally as well. We wanted to make the product better. One of the issues is porosity. And we designed a patented way to put slits in these membranes so that the surgeon could, by stretching, increase the porosity from 0 to whatever the wound required. This also gave us the ability to manage burns, which we already knew we could, but also chronic wounds. So that is a significant technology that's now patented. Well, I've been working with BioDot for about 3 years. Their equipment, it works well for our manufacturing process to very efficiently and accurately get the molecules, the biocoating, into the three-dimensional matrix where we want it. Going forward, we anticipate the relationship being even stronger, because now, in addition to the biologicals that we already have established that are very important and effective, we want to add the University of Rochester's anti-scar compound. And we want to work with Dr. Phelps and his team in that regard. So we will be working with BioDot on these advanced skin substitutes, and that's going to be happening in the near future. We see possibilities of getting FDA clearance by a combination product 510K, and that could happen as early as this year.